Good morning and welcome to the big story right here on BDTV Breakfast Show. I am Deborah Ezeh. Now today we're turning our attention to one of the most pressing issues in Nigeria, affordable healthcare. For many Nigerians, getting quality care often comes at a price too high to pay. From out-of-pocket expenses that push families into debt and the lack of financial structures that make healthcare accessible, the challenges are real. But what if the solution is not just more hospitals or doctors, but rethinking how we fund healthcare? That is where innovative financing models comes in. Joining me this morning is Jennie Nwokoye. She's the CEO and founder of Clafiya. And Clafiya is a healthcare fintech platform providing health saving accounts that help individuals, employers, and diaspora communities save, earn interest, and pay for care across a growing network of over 3,000 providers. Now, the platform is building the financial infrastructure for health in Africa and making healthcare more affordable and accessible to millions. Jennie, it is really great to have you join us on the big story this morning.
Thank you so much for having me. I'm really excited to have this conversation with you.
You're welcome. I'm actually very excited to see this part of the healthcare that people don't really talk about. So, from your experience, at what point do you see to think that financing is the problem we have in healthcare and not just the infrastructure?
Yeah. So when we first started Clafiya in 2021, we started in Enugu, and we started by sending health practitioners to our customers' homes, and they were doing anything from blood sugar screening, hypertension, just anything that falls within basic primary care services. And we realized that although they really liked the convenience that we were providing for them, the number one barrier was cost. So we saw this particularly with women, where they would often delay care because they're paying for it out of pocket. And so it was around that time that we started to think about, okay, if we do not solve this issue for cost, it doesn't really matter how much we grow and we scale. We're not going to have people who can access our services, because I think it's about 90% of Nigerians pay for healthcare out of pocket. And so we just decided that we really needed to solve for cost. Otherwise, we wouldn't have a business in the next 3-5 years.
Right.
Yeah.
Okay, so can you, we all know that many Nigerians, like you said, they actually get healthcare out of pocket. So do you think this model is unsustainable, and what risks does it imply for the poor families?
Yeah, I mean, it's definitely unsustainable. I mean, coming from my experience, I lived most of my life in the United States, and I had health insurance. Even though health insurance then was really expensive, I was paying $500 a month for health insurance alone. My parents at some point were paying about $2,000 for our family a month, right? Now bring that context into Nigeria, where you don't have that safety net of insurance, and people are paying for healthcare out of pocket. And I think the one thing is that we don't realize how expensive healthcare is. We don't really understand the true cost of healthcare. And it's so when we only start to realize that when we want to access healthcare, because there's a reactive environment where we're just okay, I'll just get it when I need it, and we want to make sure that people are practicing preventative medicine. And so when you have when you live in an environment where people are more so reactive to their healthcare and do not understand or know the true cost of healthcare, that is when they start to experience these financial shocks when they want to access healthcare, and they may not have an insurance plan, or they don't have money set aside for their healthcare needs. And so what happens is that they further delay care, or they start trying to pull funds from trying to raise funds, but at that time it might be too late. And so we hear stats that paying for healthcare out of pocket is the quickest way to push people further and further into poverty, because there are just no that framework or that structure to help us take care of our healthcare from a finance perspective.
All right. From my intro, we can see that Clafiya has been described as a healthcare fintech platform. So can you break down how it works in simple terms, especially for people in the rural environments that do not have a bank account or can think about how it works?
Yeah, so I like to think of essentially how Clafiya works is it has three parts to our platform. You're financing your healthcare and you're also accessing healthcare on the same platform. When our customers sign up on our platform, they get a free health savings account, or HSA for short, so you don't require your BVN or NIN, and that helps with people in rural areas who may not have that information readily available, either because they don't have the documentation or they don't have the centers closest to them to get a BVN or NIN. They can easily sign up on our platform using our USSD platform or our web application. They get a free health savings account that earns 10% per annum. And so they can set money aside as often as they want. We have customers that set aside money monthly, they do it daily, but it's really to just help encourage our customers to start saving for their health, or at least having some sort of financial net when it comes to their healthcare needs. And then when they do want to access healthcare, they have a network of 3,000 plus growing healthcare and wellness providers who they can access healthcare from at discounted prices. So if they want to speak to doctors or telemedicine, that's very, very popular in our platform. They can do that. We have like a certain segment of customers that really like the wellness side of things. So they use it for their spas, they use it for skincare, they use it to go to the gym or healthy foods. Or if they want to get medications, they're able to get it at discounted prices on our platform. Even if they want to buy health insurance, they can also do that at discounted prices on our platform.
So what about the people in the rural environments? Can this also work for them?
So it can work. I mentioned that we do have our USSD based platform where our customers can dial our USSD code. They automatically get an HSA account. And if they want to start saving, they can do that. If they want to access healthcare, they can also do that as well. The challenge that we see in the rural sector is that you're dealing with not just providing a financial platform for their health, you're also dealing with the lack of infrastructure. So even if they were able to put money aside for their health, how can we ensure that they get quality health care, right? So we have to do the job of aggregating like healthcare facilities that may not be as close to them, but that's why we also included telemedicine. So it's not the perfect solution, but at least if you do want to speak to a doctor, you can do that via WhatsApp, you can do that on a phone call. But that's how we are serving our customers in the rural area. But it will take much more of a concerted effort with either the government to help with that infrastructure, and then either donor orgs or just a partnership or consortium of like different bodies to ensure that we can really, really meet the rural communities in the way that they need and deserve.
All right. One good thing about your platform that I've seen here is the fact that it's not just for individuals, employers, and even diaspora community. It's like bringing everyone together in the healthcare. So how important do you think this ecosystem approach is to making the healthcare truly what it should be?
Yeah, so like what we do for employers is that we help them save on their healthcare spending benefits for their employees, and then we give their employees choice. So instead of them being boxed into a health insurance plan that may not meet their needs entirely, the employers can give their employees a health savings account, and then they now have choice on how they want to spend on their healthcare benefits for themselves. So if they want to like use part of it for health insurance and then use the rest for things that their health insurance doesn't cover, that's what they can use their HSA for. Our employers really like that because if you think about health insurance, if you don't use it, then that's money that goes into a black hole. You never get that money back. But with our HSAs, they can save money. It earns interest if their employees aren't using it, even though we hope that they are, because we do want them to have like a healthy workforce. Then they can get that money compounding year over year, earning interest. And again, it just helps to reduce that spend and manage their spend that they allocate for their employees' health and wellness. Now, if you think of like communities in the diaspora, you hear every day on Twitter, on social media, just even amongst our friends, talking about Jagba syndrome, where we are leaving the country in droves. Our healthcare professionals are leaving the countries in droves, but there's still that sort of connection back home where you still want to ensure that your loved ones can get proper health care, and you want to make sure they're doing it in a way that is trustworthy, it's safe and also affordable to them. So we actually did a campaign with Flutterwave's Send app where their customers can send money directly to our HSAs at no charge, and their families back at home can access healthcare directly on our platform. So there's no issue of like, okay, I sent money back home, but I don't know what they used it for. If they are sending money directly to our HSAs and they add their family members as a beneficiary on our platform, they're guaranteed that their family member will get the healthcare that they need. So that's essentially like what we're doing to ensure that we can build this ecosystem of people who can access healthcare either through like someone who's a gig worker, so it's an individual, an employer who wants to provide more affordable health benefits to their employees, or communities in diaspora who want to ensure that their loved ones can get care back home when they're not around.
All right. Nigeria has had national health insurance scheme in the past. So, many citizens still benefit from it. So, what innovation model does Clafiya has to surpass this?
So I think our model is innovative in the way that it is. So let me take a step back. In Nigeria or in emerging markets, I think we have a really great opportunity to redefine what healthcare financing looks like. If you think of more developed countries like in the United States that's had like health insurance for years, and I'll say most Americans do have health insurance, they are still very much unhappy about their health insurance. As I mentioned, I was paying $500 a month and it still didn't cover all of my needs. I still had to pay out of pocket for certain things. And so you see in the Western or developed countries where health insurance as it is changing, right? People want it to be more personalized, be more flexible, to cater to their own needs. And that's what I think what we do at Clafiya that's innovative about us is that instead of just, giving you something that doesn't take into consideration your medical history, right? Like you as a person today and you as a person tomorrow, we give you the choice of like saving for your health. And then when you do want to access healthcare or buy health insurance, you can we help you put something together that ultimately becomes personalized to you, and we make sure that you can be healthy. We use your past medical history that you're putting on our platform, and we're able to use AI to like just create a personalized experience for you. And so I think what we can do in Nigeria is, especially from a policy level, is to start exploring these other ways of meeting our citizens where they are, and instead of trying to basically put something in front of us that we don't want, or I won't even say don't want, we don't necessarily understand how like health insurance and how health insurance is beneficial for us and why we need it in the first place. I do believe health insurance is needed, but I think, we just need to we need to do a lot more education on like health insurance.
Right. So beyond affordability, which is something that Clafiya has, there is also issue of trust. Now, trust in the sense that how do people make sure that their monies are actually being used to get whatever it is they want done, and they are actually able to get value for the care that they need?
So that's a great question. When we were building Clafiya 2.0, when we launched our HSAs, we really wanted to ensure transparency, right? Because as I mentioned, a lot of Nigerians do not know like the true cost of healthcare until we want to access it. So we did that. The first way, we ensure that our customers' funds are like safe. We partner with a financial partner who has been in service in Nigeria to Nigerians for savings and investment for 9 years. They have a very, very strong brand. So we work with them to ensure that our customer funds are safe, that they're able to earn interest on their funds. And then when they do want to use it for their healthcare needs, there are no issues. Another thing is to ensure that when our customers want to access healthcare, they are able to access it at that time. For me, like for Clafiya rather, one of our leadership principles is patient experience. And that is like really any healthcare company's bread and butter, to be able to ensure that we provide a great experience to our customers. the moment they like get on our platform, we want to make sure that they can sign up immediately. They have no issues with signing up. When they do want to access healthcare, there are no issues with that. And even if there's any issues, they have customers support that they can reach out to resolve those issues. A lot of those things might seem cumbersome, but that is the work that we have to do to ensure that we build trust. And just taking it a step further, when we bring our healthcare providers on our platform, we vet them. So we make sure that they have all the qualifications. We just don't onboard any healthcare facility or any healthcare provider on our platform. And that also ensures that when our patients, our customers need healthcare, they are getting it from like trusted and vetted healthcare facilities or healthcare providers. And those are the things that we do to ensure that we provide great service and build trust in our environment.
Speaking about the healthcare providers, the app has vetted over 3,000 providers. So what does this process look like, bringing healthcare, providers on board, and how do you ensure this quality?
Yeah, so as I was saying before, I mean, it was honestly onboarding the 3,000 providers on our platform wasn't an easy task. We had to tap in deeply into our network to make sure that we were getting them on board. But as I mentioned, that we had to make sure that they were vetted, right? And so there are organizations in place where we can make sure that if a doctor wants to become onboarded on our platform, we can at least check their licenses and make sure that it's whatever they're sending to us is not fabricated or fraudulent. We do interview them. We do reference checks, and then when they do come on our platform, we provide like an onboarding session just so they know how to do things like the Clafiya way. We test for like just communication, how relatable they are, how like I would say friendly and warm they are, but really just to ensure that they can provide a great experience for our customers who need telemedicine services. For those brick and mortar providers, we've actually gone to visited these facilities ourselves just to see what they look like, just to see that, the service that they say that they do provide, their services that they actually do provide. So that's essentially what we do to ensure that we're onboarding trusted healthcare providers on our platform who can provide like great quality of care.
All right, so let's look at the bigger picture now. If Nigeria would scale like this in nationwide, actually, so what impact do you think it's going to have on our healthcare system?
I think it would have tremendous impact on not our platform, in our country, because cost is the number one barrier to accessing healthcare. And if we really just do not solve for cost, it's going to be very, very challenging for healthcare to scale. And that's what I'd say like a lot of healthcare providers struggle with, is because there isn't that financial infrastructure that's readily available to help them scale, to help them generate more revenue for their establishments, that they can reinvest and provide more quality care, make sure they can pay their staff well. You find out these businesses do not last long, or it impacts the quality that they're able to provide. And so being able to solve for that cost or that financial construct that can help reduce costs of care will go a long way with scaling. But not just that, I think we also need policies that really enforce the need to drive healthcare financing, not just for the consumer side of things, but for the health provider side of things, providing incentives like tax incentives that, let's say, if you have people who are saving in an HSA, can they get some sort of tax incentive because they are taking a more proactive approach to their health. And that means that the government doesn't have to spend more money on their citizens because their citizens are already taking a more proactive approach to health. Or for health businesses that are providing health, a very crucial and social need for our communities, for our country, can they also get incentives for the kind of businesses that they run? So I think it's not just solving for that cost, because we can do that, but if we do not have an enabling environment that will help boost trust, education, and like enforce the need for healthcare financing, it will be a struggle for us to scale and for any healthcare provider to scale.
All right. So you're someone who actually mentors young entrepreneurs, innovators. Now, for the young innovators who wants to like solve the problem of healthcare financing, what message do you have for them?
What we're doing is really, really hard.
Yeah.
It's very hard, but it's very rewarding. I get this question asked every day. Not every day, but like every now and then. If I had an opportunity to run a business or start a business again, would I still be in healthcare? And the answer is yes, because we're solving a very crucial need. And really, if we do not have a healthy workforce, we don't have healthy citizens or healthy communities, our communities won't thrive. I see like our parents' generations who are like dying at young ages, like at 50s and 60s, and it's very sad, and if we don't solve for these sort of things, that's kind of the reality that we have. But I'll say like the good news is that I feel like our generation is becoming more sensitized to their health, wanting to be more health conscious and taking a more proactive approach to being healthy and being well. So I'll say really to any health provider, the work ahead of us is hard. We haven't even scratched the surface of all the work that we need to do, sincerely, but to just keep at it and know that it is very, very rewarding work.
Speaking about still not being able to scratch the surface, what more should we expect from Clafiya?
Wow, that's a very interesting question.
Yeah.
So for us, we want to be able to, I like to think of, when I think of Clafiya, I like to think of Clafiya as like an OPay for health.
Okay.
So like, everyone, essentially most Nigerians at some point have an OPay account. And so that's how basically this distribution in our scale of our HSAs, our customers or Nigerians have an HSA that they, that is in just a part of their everyday lives when it comes for their health. We want to be able to, again, like make healthcare more personalized, more and more centered around you as a person who's consuming the health. We have like different ways that we're thinking about just doing more healthcare financing, not just from a savings perspective, but like partnering with health insurance companies to help scale our HSAs, or like provide like a more complimentary package so that it's more personalized, or providing loans or credits for our customers that really need to access healthcare, but they cannot do that because they don't have like existing funds available to save in their HSA. So those are the kind of things that we want to do. My vision is that essentially everyone in Nigeria has an HSA, just like just about everyone has an OPay account because of the reliability of OPay. Then similarly, that's how it is for Clafiya.
All right, thank you so much, Jennie. It was so good to have you on the Big Story.
Thank you so much. I really appreciate it.
All right, we're speaking to Jennie Nwokoye. She's the CEO founder of Clafiya, and we're speaking on innovative financing models for healthcare in Nigeria. But that's the much we can take on the Big Story on the Breakfast Show. Up next is social listening with myself and Destiny Mama. Just stay with us.